Welcome to Let's Talk Pain. I'm Carol Martin. On Let's Talk Pain, we're going to be speaking with people who live with pain and those who treat pain as well. I'm joined today by Dr. Eugene Viscusi and also by Kathy Church. Now, with their help, we hope to better understand how pain affects people's lives, also to learn about some of the tools and tactics that can help you best manage pain. Let's Talk Pain is not only the name of our program, but it's first and foremost a coalition whose mission is to increase awareness of pain and improve how it's treated. Through Let's Talk Pain, we want to encourage people who have to live with pain and their healthcare professionals to talk about the issues at hand, also to listen actively to one another, and then take action to improve care for those living with pain. Hopefully, we can open a conversation around this very sensitive topic. Now, chronic pain, of course, can be overwhelming. Treatments differ from patient to patient, and there are often side effects that can add to the challenge of pain management. In this episode, we're going to talk about tackling some of those challenges. Kathy Church, we're glad you're with us today. Let me tell you Kathy's story. She's a social worker and a 2008 recipient of the National Pain Foundation's Triumph Award. Her story is really amazing. About 15 years ago, while on active duty in the Army, she suffered a surgical error that led to chronic pain and 13 follow-up surgeries. She then took a medical discharge from the Army, but there was really no relief from her pain. Kathy focused on her education, ultimately earning her master's degree in social work. She now works to improve care for those who must endure chronic pain while fighting her own battles as well. She's testified at the federal level about the needs of pain patients and also the need for better education about pain care for physicians. I encourage everybody to go to letstalkpain.org and watch Kathy's in-depth profile to really learn more about her triumphs through this adversity. And of course, it's really good to have you with us, Kathy. I also want you to meet Dr. Eugene Viscusi, who is the Director of Acute Pain Management and Regional Anesthesia, also an Associate Professor of Anesthesiology at Thomas Jefferson University in Philadelphia. Dr. Viscusi also lectures internationally. He has authored more than 100 book chapters and 50-plus peer-reviewed articles in scientific journals, so he knows that about which he speaks. We're glad to have you with us as well, Dr. Viscusi. Let's get started talking about these challenges, and there are so many. I'll ask the first question of you, Doctor. How does someone start on a path toward understanding where to start?
Well, I think the first challenge is finding the resources that are available. And for many patients, pain, both acute and chronic, is overwhelming. And navigating through the healthcare system and finding providers who are sensitive to pain issues can be a real challenge.
And you make the point that pain is real, so the stigma about whether you're actually feeling it.
Well, I think the particular challenge is that there is a view that pain is entirely subjective and that it is a personal experience, and that therefore there may be less credibility to some complaints of pain or less believability, and that there truly are validated ways to measure pain. It's not just purely a subjective experience. We have tools or instruments that are very reliable and reproducible that can be used to evaluate a patient's pain experience.
And to that point, Kathy, I know you can speak. You have to be vigilant about trying to find your way out, yes?
Yes, it's very difficult. You can get caught in almost a quagmire in the healthcare system. You have to be able to advocate for yourself. You have to be able to educate yourself as much as you can on treatments available, but also be open to hearing what your doctor has to say. I think physicians want to treat a patient who is actively involved in their treatment, but not closed-minded about their treatment. So it's a fine line between knowing what you want and working with your physician together to come up with the best treatment. But also at the same time, if your physician isn't listening to you or you don't feel listened to say, hey, I'm still in pain, this isn't working for me, can we please try something else?
And your story, as we said, 13 surgeries. Again, at letstalkpain.org, we can hear more of your story.